Imagine reaching the peak of medical science, securing a massive income, and then dropping a scalpel to live in mountain isolation with a dog. Dr. Jonathan Choi reached that peak. He carried the prestige of an MIT education and a grueling decade of specialized training in neurosurgery. By age 38, he possessed everything the world defines as success: financial security, professional respect, and a stable, happy family life. Then, in 2023, he abruptly quit. He walked away from millions in future earnings, leaving his colleagues and the medical communities searching for an explanation that made sense. This wasn't a standard case of professional exhaustion. Dr. Choi had reached an ideological crisis that threatened the core logic of modern medical practice. To understand his departure, look at the mechanics of his daily work. This X-ray shows the lumbar spine, where he would physically cut away disc material to relieve the pressure on spinal nerves. Even when the surgeries were mathematically perfect, the outcomes varied wildly. Some patients recovered fully, while others remained in chronic pain or even saw their conditions deteriorate. The most baffling cases were the patients who spontaneously healed while waiting for their operation dates, long before a surgeon ever touched them. He saw the human body as a water-damaged house. If rain pours through a roof hole, it rots the walls. Surgery acts like replacing moldy drywall without patching the leak. The new material is ruined almost instantly. Surgical intervention manages the physical debris of a disease, but it lacks the tools to address the root cause that started the damage. Dr. Choi noticed that the patients who stayed healed shared a specific profile. They prioritized plant-based diets, outdoor activity, and maintained deep social connections. Relapsing patients, however, often lived with chronic stress, isolation, and poor nutrition. Their lifestyle guaranteed that the disease would return, regardless of how well the surgery was performed. Looking at this facility, we see a corporate entity with a distinct revenue model. The growth of such an institution relies on billing for high-cost surgical procedures, not on providing the free lifestyle advice that might prevent the need for surgery. This creates a direct conflict of interest. If a doctor successfully teaches a patient how to heal themselves through behavioral change, the hospital loses a recurring customer. Dr. Choi realized he was working for an industry that generates profit by maintaining a state of sickness. This realization is what he calls his moral injury. The current state of healthcare represents a system functioning exactly as its financial incentives intend. If lifestyle choices form the physical foundation of health, then our internal emotional and spiritual states represent the invisible blueprint beneath them. In 1925, the Game of Life proposed a radical idea that our physical ailments are actually direct projections of our internal disharmony. The subconscious mind acts as an unthinking executor. It takes our deepest stresses, fears, and resentments and faithfully manifests them into our physical reality. This diagram shows the biological consequence. When emotional stress nodes radiate from the brain, they chemically and structurally disrupt the body's cellular balance. Persistent anger or a lack of forgiveness eventually solidifies into physical blockages, manifesting as joint inflammation or the hardening of the arteries. Our physical form mirrors our internal state. This suggests that true health is impossible until we resolve the emotional toxicity within. Dr. Choi faced a final choice: continue participating in a profitable lie or accept total financial uncertainty to save his conscience. Today, he lives in a vastly different reality. While his finances are tight, he is no longer bound by the demands of the medical-industrial complex. He found peace in nature, in prioritizing sleep, and in living a life that finally aligns with his values. Reclaiming control over your life often requires the courage to walk away from everything society calls success. Modern healthcare encourages patients to look for external fixes, but actual healing requires a shift toward internal responsibility. Our biological system is a self-repairing ecosystem. As this microscopic time-lapse shows, the body is designed to seek out and destroy threats on its own. In this framework, medicine expands to include the thoughts we cultivate, the community we build, and the nutrients we consume daily. Ultimate health isn't a product you buy from a hospital. It is the direct reward of how you choose to play the game of life.